Welcome to WebMD's Ask the Pharmacist. We're going to answer some of the most common questions about medications, prescription, and over-the-counter with our expert Makary Marciniak, Clinical Associate Professor with the UNC Eshelman School of Pharmacy. Today we're talking about allergy medications. Let's get started. The doctor said that my son's pink and itchy eyes are allergies. He recommended Claritin D. I tried it before and didn't like the hyped-up feeling that it gave me. I've heard about Zyrtec, but I am nervous about giving him something before sending him to school. What would you recommend?
Nice question here. So Claritin D is a medication that includes an antihistamine and a decongestant. That's the D part.
Okay.
Now, the decongestant often can give you those stimulant side effects, maybe feeling a little hyped up, a little bit more excited than normal. Now, your son might have some of those similar symptoms, but it could be a good medication to help treat his allergies. So two things we could recommend might be to stay with a medication like a plain Claritin or a Zyrtec, and he could even try it at bedtime. Maybe taking it at bedtime would be enough to control his symptoms in the daytime, and then you wouldn't have to worry about giving him a medication before school. But if that wasn't sufficient to treat his allergy symptoms, maybe adding in a decongestant like the Claritin D could be helpful. I would recommend taking that one in the morning before school. Definitely taking that at nighttime might not be the best option because that one could keep him awake at nighttime. So we want to make sure he gets his rest for school, and you could take the Claritin D before school. And hopefully that could be enough to help his symptoms during the daytime.
So these medications can last a few hours?
Yes. I think both of those allergy types of medications, Claritin or Claritin D, will last for about a 24-hour period.
My head, nose, and throat seem to be packed and will not loosen up enough to blow out this congestion. Is Flonase a steroid-type medicine? My doctor looked me over, said I didn't have an infection, and prescribed Flonase. After reading the side effects, I'm a little afraid to use it.
Flonase is a corticosteroid, so it is a medication that helps to reduce inflammation and swelling, and it may be a good choice for this person who has a lot of nasal congestion. So hopefully the Flonase will work to reduce the swelling, so make it easier for them to blow out the congestion. Now, nasal steroids like Flonase are very effective and don't have a lot of side effects. So what I would suggest is that this person first start by blowing their nose completely, as much as they can do, then use that medication by inserting it into their nasal passages and spraying in the appropriate dose, and then give it a chance to work. They will hopefully be able to see a reduction in the swelling so that they can blow out that congestion. And it probably will take about a week of using that medication to see the total effect.
I've started having allergy symptoms a few weeks ago. I've tried Allegra, but it doesn't seem to help much. I've heard of Zyrtec and Claritin, but I'm not sure which one I should try next.
So Claritin, Zyrtec, and Allegra are all antihistamine type of medications, and they all work very similarly. They help to block your histamine response that your body experiences when you're exposed to a trigger. So they all work very similarly, and I think somebody could start with one medication or another. So if they've tried one and it's not working, and it's been at the appropriate dose and for an appropriate length of time, it's okay to try one of the other ones. They may get a better experience from one medication versus another, but generally they all do work the same way.
But different ones might work differently for different people, is what you're saying.
That's correct.
Once spring allergy season started, I woke up with a headache, bad sinus pressure, and a runny nose. Advil helped somewhat, but not with the sinus pressure, so I started taking Zyrtec D along with the Advil. I still have a runny nose. Is it safe to take Zyrtec D long term?
There are a number of people who suffer with allergy symptoms and do use medications like Zyrtec D long term, so it is safe to use. Zyrtec D includes both the antihistamine, which would help with maybe itchy eyes or that runny nose, and the D is a decongestant, which might help with some of that nasal congestion, and that might help to relieve the sinus pain or pressure that that person was experiencing. So if they are somebody who has allergies long term, Zyrtec D can be a very safe option for them to use long term.
What over-the-counter allergy medications are best on the market? I have really bad allergies that are getting worse quickly. I take Zyrtec every day, but it's not enough. I started taking Claritin with it as well, and that has helped a bit. I'm just confused on what's what and think I need to be taking meds for a broader spectrum of allergies. Those are bad allergies.
Bad allergies, and lots of good information and good questions as a part of that. So let's kind of break down some of those concepts. So there are a number of different allergy products available over the counter. A lot of pills like Zyrtec, but also there's eye drops or even nasal sprays. So a lot of choices. So I think it might be best to match up this person's symptoms with the medication that they should use. So Zyrtec could be an option, but I'd probably recommend using only one oral antihistamine at the same time. So this person seems to indicate they were taking Zyrtec and then added Claritin. I'd probably say it's better to stick with one and make sure that you're using the right dose. If you find that's not enough, then we maybe could add in a medication that has a different way of acting. So maybe an antihistamine plus a decongestant might be helpful for this person. And we'd probably need to make sure that it doesn't interact with any other prescription or over-the-counter medications that they take. And also another good thing with allergies is to look at what's in your environment. So sometimes allergies get worse if you're exposed to different triggers in your area. So maybe for you, pollen's a trigger, and maybe we could do some other things like limiting your time that you spend outside or closing your windows inside, or maybe even vacuuming more often in your home. There may be some other things we can do in your environment to help reduce the allergies so you're less dependent on some of the medications.
And your local pharmacist would know what's most common in that area, right?
That's true, and can help you with some of those suggestions to make sure all of the things that you're using, what you're taking over the counter or maybe by prescription, or things you're doing that aren't including medications can be the most effective regimen for you.
I started using Astelin 2 days ago. Each time I used it, I have to blow my nose immediately because my nose starts to run. Am I doing something wrong, or is that normal?
This person is probably not doing anything wrong, but sometimes a bit of a runny nose can be a side effect of using nasal sprays. So the first thing I'd suggest is that if you are using a nasal spray for allergies, you want to blow your nose out first before you use that medication. Best is to try to clean the airway and the passageway as best as you can before you insert that medication. Then give your sprays and give that time to work. And if you have a little bit of a runny nose, it's okay to use a tissue to dab your nose. You won't need to use another dose of the medication, even if you have a little bit of a runny nose.
I've tried several oral medications and nothing seems to help with the nasal congestion. When my nose gets stuffed up, I use the over-the-counter nose sprays, which I know are not good to use, but it's the only thing that gives me temporary relief. Do you have any other suggestions?
So people who suffer with allergies sometimes have symptoms that go through their whole body. Maybe their mouth gets dry, maybe it's itchy, maybe sometimes the symptoms are just in their nose, so that a runny or an itchy nose. So if your medications might be all over, an oral medication is the best choice. But if the symptoms are only in the nose, a nasal spray is an effective and a safe choice. So there are nasal sprays over the counter that are decongestants. They are safe to use, but only in a short term, maybe about 2 to 3 days. Unfortunately, if you keep using them longer than that, sometimes you'll have rebound congestion. So it's okay for this person to use a nasal spray to help with their congestion, maybe just limiting it to that 2 to 3 day window. And maybe they can use other things like a saline nasal spray. They can take that every day. That can help to release some of the congestion, and that is also safe to use long term.
My allergies flare up at night and I cannot sleep. I have to be at work at 7 a.m. and I'm very sleepy. I do not want to drink caffeine. I've tried Zyrtec, Claritin D, Claritin, and I still have major issues. I don't know what else to do. Good question.
And you can see this person's very troubled by their allergy symptoms. So we do need to make sure we have the right medications on board. It sounds like this person has tried a couple of different allergy options. Hopefully it's been at the right dose and for enough of time to be able to see a difference. Now, sometimes people do have difficulty when they go to sleep at night, maybe a little bit of a postnasal drip that irritates their airways and causes them to have difficulty at night. So a couple options could be maybe taking their dose of their medication closer to bedtime. So maybe not in the daytime, but maybe at nighttime. That might help, and I think that would be a good strategy if the medication they're using is a Claritin or a Zyrtec. Now, if it's a Claritin or a Zyrtec D, you wouldn't want to take that one at nighttime. It has a decongestant in there, and that could keep them awake at night. Now, I'd also like to look at the bedroom that the person's using and maybe see if there's any triggers that we can reduce in their environment. Maybe they're having some reactions from dust in the room or maybe allergens on their pillow. So good tips might be to wash their sheets once a week in hot water, maybe to dust frequently, more frequently than they're doing now, or vacuuming really well. Perhaps that could help in some of the environment to reduce the types of allergies they have at night and make them a little bit able to get through their day.
I just moved to California. My neighbor informs me that I should take allergy medication every day as there are a lot of allergens in this area. Is it necessary to take a medication 365 days a year or just if the symptoms occur?
I think it's a great question to be asking. So I wouldn't take a medication simply because that's recommended by a friend or a peer. You need to make sure it's the right choice for you. Now, some people have allergies only during a certain time of year. Maybe there's certain things that trigger symptoms for them, and they only need those medications short term. We call that seasonal allergies. Some people may have allergies all during the year, perennial allergies that occur anytime. Maybe there's things in your environment like dust that are there 24/7. So some people might need to take medications in the short term. Some people do need it 365 days a year. So I would talk with this person a little bit further to see what their symptoms are like. If they have never had these symptoms themselves, then they don't need to take those medications, even though a friend or a colleague might need those medications. So let's just make sure it's the right choice for this person.
Zyrtec is the only medication that really helps my allergies. I don't take it because it puts me to sleep. I take loratadine, which does nothing. I was thinking if I could cut the Zyrtec 10 milligrams in half and only take 5 milligrams a day, maybe I wouldn't be so tired. Is it safe to cut the pill in half?
So good question. In general, cutting a pill in half could be a strategy that would be appropriate for this person. Now, sometimes when we cut a pill in half, we can't exactly be sure that you're getting exactly half of the dose. So just because you cut a 10 milligram pill in half may not mean you're exactly getting 5 milligrams. Now, it also might be helpful before you cut a pill in half to see if there's something else on the market that comes in available in the strength you're looking for. Perhaps you don't need to cut the pill in half. You can just buy a lower strength product that's available. I'd also say that it'd be important for somebody to take their medication perhaps at night. Maybe then the sleepiness won't be bothersome to them if that's one of the side effects they're experiencing, versus maybe taking it in the daytime and then having symptoms of sleepiness throughout the day.
What should I look for when choosing an over-the-counter allergy medicine?
So there are a lot of products available over the counter to treat allergies. We have some oral medications that are antihistamines. We sometimes use oral medications that are decongestants. We even have nasal sprays that we can use too. So lots of different product forms. So I think first might be to know what allergy symptoms you have so we can match the right product to your symptoms. So if your symptoms are only in your nose, like an itchy or a runny nose, maybe a spray is sufficient. But if you also have maybe itchy eyes or a runny nose, you might want to take an oral medication. So I think we'd want to make sure we look at your symptoms to see what they are to find the right product to match your symptoms.
Will the box or the bottle say that on it?
Many of them can kind of give you an idea of which products might be best, but it also might be helpful to talk with your local pharmacist. They might be able to suggest the products to treat the right symptoms.
How much time should I give an allergy medicine to work? Days, weeks?
Most allergy medications work pretty quickly. So for the oral medications, you'll probably notice a difference that day. They'll probably start taking effect then. But I'd probably give you about a week's of use to really see a major difference in how you're feeling with your allergy symptoms. Some of the nasal sprays that we have over the counter work very quickly, so you'll feel a difference within hours.
What should I be careful about when taking over-the-counter allergy medicines?
So allergy medicines that are available orally probably have side effects of either making you very drowsy or maybe making you very excited. So I think I would look to see what the ingredients are. If it's an antihistamine, some of them make you very sleepy. If your product includes a decongestant, those are the ones that might make you a little bit more excited, maybe have a little bit more difficulty sleeping if you're taking it at night. So most of your side effects are very mild and can be managed very easily, but those are probably the most common ones you'll see over the counter.
What should I ask my doctor if he or she prescribes an allergy drug for me?
This is a great question. I think anytime a physician or a healthcare provider recommends a medication for you, you should ask at least 3 basic questions.
Okay.
What's the name of that medication? And they might explain it to you like a brand name or a generic name. What should it be used for? And how should you take it? So how will you be able to use that medication? Is it once a day or twice a day? And maybe even adding in what you should expect from using that medication. How will it work? And how soon will you see an effect? And when do you need to come back to the doctor to make sure that that's the right choice for you?
Well, McCary, that's going to do it for us today. Thank you. And thank you for continuing to count on WebMD as your source for health information.